Artificial intelligence is starting to play a role in helping doctors screen patients for common medical conditions. However, a recent study has raised concerns about whether physicians may be leaning too heavily on AI support. Research conducted with gastroenterologists in Poland revealed that once doctors became accustomed to an AI-assisted colonoscopy system, their independent ability to detect polyps and other irregularities dropped by about 20%. The results, published in the Lancet Gastroenterology and Hepatology, suggest that even a relatively brief period of exposure to AI tools might cause specialists to rely too much on them. "We didn't expect this outcome," said Dr. Marcin Romańczyk, a gastroenterologist and researcher at HT Medical Center in Tychy, Poland, who led the study. "Not everyone agrees that the findings prove doctors are losing essential diagnostic skills because of AI. 3 months seems far too short to forget a skill that took decades to develop," said Johan Holman, a researcher at the University of Manchester in the UK who studies human reliance on AI. He believes factors such as differences in patient demographics, like age ranges, may have influenced the apparent decline. AI in healthcare. AI tools are increasingly being used in routine medical imaging. Eye exams, breast cancer screenings, and colon scans are just a few areas where artificial intelligence is becoming common. AI is spreading everywhere, Romańczyk noted. But many doctors are still learning how to adapt, since AI training was never part of their medical education. "We were taught from books and mentors," he explained. "Nobody showed us how to work with AI." Several years ago, for clinics in Poland tested an AI system designed to detect abnormalities during colonoscopies. The software analyzes real-time video from inside the colon and highlights suspicious areas for the clinician to review. In this case, the system draws a green box around the area where it believes a polyp might be, Romańczyk said. The initial goal was to test whether the AI worked, and it did. But when researchers later revisited the data, they noticed something surprising. Once the system was introduced, doctors performed worse at spotting polyps without AI assistance. According to their analysis, the detection rate fell from 28.4% to 22.4% when the AI system was switched off. This suggests that physicians quickly developed a reliance on the AI's prompts. Romańczyk speculates why we're subconsciously waiting for the green box to appear and paying less attention ourselves. Other research supports this possibility. A similar study found that non-specialists reviewing mammograms performed worse when they knew an AI system could assist them at the press of a button. Holman, who co-led the mammogram study, calls it a safety net effect. While he finds the new results intriguing, he remains doubtful. He points out that the colonoscopy study lasted only 3 months and involved experienced doctors. Statistical variations, such as differences in patient groups, might explain the findings. He also cautions that the true number of medically significant polyps is unknown. "We don't know what was really there, so we can't be sure what was actually missed." Romańczyk, however, believes the decline is genuine, though he acknowledges that testing AI in clinical practice is inherently complex, with many uncontrollable variables. Importantly, he is not against AI. On the contrary, he finds the AI assistance helpful during colonoscopies. But he insists more research is needed to fully understand how AI is reshaping medical practice. "Look at what's happening," he said. AI systems are already available, but the data on their impact is still missing.